Why do IVF cycles fail? This is a common question which often perplexes patients. After all, isn't the doctor actually making an embryo in the laboratory? And when he puts the embryo back in the uterus, shouldn't it stick and become a baby? So if the problem is that they're not getting pregnant in the bedroom because the tubes are blocked, and the doctor has bypassed that problem by making the embryo, and the embryo is top quality and the uterus is normal, then isn't it logical that that embryo should stick and she should get pregnant? And that's why patients find it so hard to believe that IVF cycles fail, and they can't understand why they fail. So I think we need to break up an IVF cycle into two groups: things we can control and things we can't control. What are some of the things which we can control? So we can control how many eggs the patient grows. We can control how good the quality of the embryos will be, because this depends on things like the super ovulation protocol we use and how good the laboratory is and how good the embryologist is. So that much is within our control. Not always, I completely understand that. For example, if the patient has poor ovarian reserve, then no matter how good the super ovulation protocol, she is going to get few eggs and the embryo quality may be poor. But at least making embryos is something which is in the doctor's hands, and that is directly dependent on the skills of the IVF specialist and the embryologist in the IVF lab. But, and this is a big but, that's all we can control. Once we've made the embryo and then transferred it back into the uterus, we have no control over whether that embryo will implant or not. That's because implantation is a biological process which we cannot influence. We can try to enhance the probability of that embryo implanting by doing a smooth transfer, by providing luteal phase support with estrogen and progesterone. But at the end of the day, because it's such a complex process, because the embryo has to send all the right signals, the endometrium has to accept those signals, the embryo needs to invade into the endometrium, establish a blood supply, so many things which we can't control. And not only can't we control them, we can't even figure out what's happening, because you're putting a microscopic ball of living cells inside the uterine cavity. How can you control its fate? So that you hope that an embryo will implant, but the reality is you have no control over that. Which again brings us to the point that, God forbid, but if your IVF cycle fails, you should have enough details about the actual medical treatment which was given to you. What drugs were used for superovulation? How good was your endometrium lining? Was it texture okay? How many follicles did you have? What was your estrogen level? How good were your embryos? Because based on these data points, the IVF doctor can then adapt and tweak and modify your protocol to increase your chances for success for the next cycle. Often, if you have top quality embryos with good quality endometrium, there may be no need to change anything. It may just be a question of being patient and repeating it again. But if on the other hand, your embryo quality was poor because the super ovulation protocol wasn't great, or your endometrium was thin, which is why the embryo didn't implant, then once the doctor knows what the problems are, he can tweak them and find solutions for them. So remember, an IVF cycle is not just a treatment cycle, it's a diagnostic cycle. It gives us valuable information, provided you get that valuable medical information from your doctor and document it. And if you'd like to make sense of it, please feel free to reach out to me. I'm Dr. Malpani. Our website is www.drmalpani.com, and I'm happy to offer a free second opinion.